So in this video we're going to go over the consultation process with the Eclipse Lumiere, the setup of the machine and any aftercare that's required with the Lumiere. So obviously with LED light it is non-invasive and very safe for most clients. Any clients that have metal implants or pacemaker, any heart conditions or is pregnant are generally contraindicated from a LED treatment. Now we'll provide you with your consultation forms for your treatments along with the LED in Word format. So you'll just get your client to read through that before they receive their treatment. Now a couple of precautions to take in mind as well is Roaccutane and also photosensitive medications. Now those two you generally can use LED light with those conditions. Now you need to take some precaution with that, and generally we would decrease the energy a little bit for their first treatment. Because they are a lot more sensitive to light, that means that the skin can inflame a little bit if we use a higher setting. So we can treat those clients, but just making sure we take that precaution. Now a normal treatment procedure after the consultation process is the client would come in, you'd do a thorough cleanse on the face, for example, if we're treating the face, remove any makeup, any oils or moisturizers or anything like that. You'd place the client goggles on, which are these aluminium white goggles here. You'd place those over the client, and then you would set the treatment head about 15 to 20 centimeters away from the skin. So if you're going to increase it any further, it will start to decrease the energy. So our measurements are taken 20 centimeters off the skin. So if you increase it any further than that, the energy is going to start decreasing. If you bring it closer, it's going to increase. So we just want to make sure it's about 15 to 20 centimeters off the skin, which is about this much, and that just means you're getting enough energy into the skin with the presets that we've got in the machine. Now if the operator is staying in the room, we recommend to put the operator glasses on just to protect the eyes. So some of the red and near infrared wavelengths have shown in studies to not actually be damaging to the eyes, but it's all about eye strain as well. So we just recommend for everyone to wear goggles, and if you are staying in the room, wearing your operator glasses. Now all we're going to do is we'll set the treatment head up over the treatment area, so say it's a lower back for back pain or the face, and we generally have it set up like this. Now if you're wanting to treat a whole back area, you would just twist these two knobs here, and you would lay that out flat and then just tighten those up again. And then you would just do the same on the other side, and that way it would lay straight across the back and you get the whole back if you were treating someone for acne or back pain, for example. Now once the machine's gone through the process of the treatment, it will stop automatically, or you can refer to the list that we give you in terms of the treatment times, and then you can set a timer and come back in and remove the machine for the client. Now after the treatment there's no real aftercare, ideally making sure that they're putting SPF on if they're going out in the sun and just trying to protect their skin. Now if you've got a specific skincare range, you can talk to your provider in terms of what they recommend to work in combination with LED light therapy. There's some really good results being achieved with the Lumiere and some different skincare ranges. So talk to your provider about that, and they should be able to give you some advice on using skincare alongside with LED. So as you can see, very easy to provide a treatment for your customers and very safe. In the next video, we'll be going over a little bit of troubleshooting in terms of using the Eclipse Lumiere.